perhaps the last place we'd look for information as to what's happening with the swine flu outbreak is the weather forecast. But as the authorities brace themselves for more cases this winter, how bad those cases are going to be is partly defined by the weather we have this summer.
What we do know is that the virus doesn't like ultraviolet light, so as the sun gets higher in the summer, it kills off the virus, and it also doesn't like being dry. So if the humidity is less, it doesn't get transmitted and doesn't survive so well. What you need is a damp, cold, not freezing, because it doesn't like that either, but cold, miserable, drizzly December morning, and that's what the virus likes the most.
And, of course, on those damp December mornings, we're apt to blame the weather and the weatherman for just about everything. But new research is beginning to confirm that it plays a fundamental role in our health. Here in the UK, for example, we're not very good at keeping warm.
The British are brilliant at being cold outdoors. A research done about 10 years ago showed that out of all the capital cities in Europe, Londoners shivered more than anybody else. And we stand around waiting, we don't wear proper things, we don't wear hats, we don't wear gloves, whereas in Paris you'll find that. If you start shivering, your body's under great stress. And if you look at the drop in temperature around about December and follow the hospital records and even deaths, you'll find that heart disease will come up first 2 or 3 days later, then stroke, and then respiratory conditions about 14 days later. So what's happening is our immune system has become compromised. It's not working so well when we've got cold. And that's one of the biggest reasons why we have such a high death rate in disease during a British winter compared to France or Finland, which has hardly any extra deaths at all.
And it isn't only us standing still that causes problems. It'll be little surprise that the weather can give us a headache as well.
Migraines, everyone's got their theory, but there's definitely a kind of association with thunderstorms, before a thunderstorm, that very muggy, kind of heavy air, and also snow. Some people almost certainly can predict when it's going to snow because of migraines.
In fact, Silas Weir Mitchell was writing about this stuff in 1877. He was working as a neurologist, looking after victims of the American Civil War, and he noticed that the amputees had a special skill.
They could predict exactly when it was going to rain, and he predicted that the rain was always 150 miles away when it started to hurt.
And now as global climate change begins to bite, the vulnerable are becoming even more so. In 2003, during a heatwave in France, tens of thousands died. But that was a heatwave across a country, and it was the vulnerable that suffered. But extreme weather can cause events in much smaller locations where everyone's affected. In July 2001, temperatures soared in the UK, and while above ground that was more or less OK, below ground it wasn't. A single train stalled on the London Underground system, and within minutes there were 3 trains and 4,000 passengers stuck underground. They were trapped for over an hour in temperatures exceeding 40 degrees Celsius. When they were freed, 600 people were treated for heat exhaustion and 18 taken to hospital. This is just one episode in one city's infrastructure that could be echoed anywhere in thousands of other cities around the world. And it points out just how much effect the weather has on our lives, and we ignore it at our peril.